The holidays approaching, it is a busy time of year, and doctors are worried that many pregnant women may not be taking the time to care for themselves or their unborn babies. In today's Your Health Matters report, HCA Midwest Health has some important reminders for expectant moms. The joy of being a parent begins long before the mother gives birth. Prenatal care is critical to the health of mother and baby.
I think every woman, as soon as they find out they're pregnant, needs to contact their doctor.
Dr. Eric Arroyo is an OBGYN at Overland Park Regional Medical Center.
I think it's extremely important that a pregnant woman have regular visits with their doctor to identify any issues that may come up that could affect the outcome of their pregnancy.
You should visit your doctor once a month between weeks 4 and 28 of your pregnancy, then every 2 weeks between weeks 28 and 36. And finally, visit your doctor every week during your final trimester.
I think every woman wants to be as healthy as they can be during their pregnancy, but there are just certain aspects of prenatal care, things, little nuances that we look at. For example, the size of the uterus early, things like this can tell us what the pregnancy will end up being, how the outcome will be, and so little things like that that you may not necessarily detect on your own, that's what we're here for, that's what we're here to help our patients with.
Risk factors signal potential complications for mother and baby.
Something such as simple as being above the age of 35 at the time of birth has some unique risks associated with it, such as increased risk of genetic issues, increased risk of preeclampsia, and those are things we like to address with our patients and tell them how we'll modify their care to make sure they have the best outcome possible.
Dr. Arroyo said, this time of year during cold and flu season, it's critical for pregnant women to get the flu shot.
All pregnant ladies, if they get the flu, they're at much higher risk to end up hospitalized. Secondary to dehydration, other hormone changes that happen in pregnancy, they're at much greater risk for serious illness for themselves. And also, a good reason to get the flu shot is that we also see some passive immunity that's conferred to the baby even after birth, because we cannot immunize these infants until they're at least 6 months of age. So if they're immunized if the mom is immunized during the pregnancy, that protects the baby and it of course also protects them from exposure later.
Making life healthier and happier for mother and baby.